Hi, I'm Dr. Diane Cleverley, Personal Healthcare Information. Welcome to this episode of How to Hack Healthcare. This is what women need to know. In this episode, we're going to tackle some of the controversies surrounding mammograms. If you live in the U.S., you know that you are told when you're 40 to go every year for a mammogram, and the ACA will pay for that. However, there are organizations, the American College of Physicians, they questioned the utility of mammograms in women ages 40 to 49. And so there was a lot of pushback, and there's still a lot of controversy over whether that particular age group, the 40 to 49, should be going for mammograms every year. In Europe and Canada, people do not go for mammograms until they're 50, and then they go every 2 years. Why would you not? Why not go in for a mammogram every year? Well, you are exposed to some radiation. So 10 extra years of radiation from 40 to 49, if you're going yearly, might add up. The chance of finding something invasive in a woman for every 2,000 women ages 40 to 49 who are screened, it is less than 1. So less than 1 woman is going to have something invasive. So there's a lot of pain, there's a lot of suffering, there's a lot of cost, there's a lot of, oh, it was nothing. And then they say, is it really worth all of the trouble to go through these mammograms? So what about breast self-exams? They're also controversial. There's a current thinking now not to do them and not to encourage patients to do them and not to teach patients to do them. The Canadian Task Force does not recommend it. The American Cancer Society does not recommend it. And the WHO promotes something called breast awareness. So what this means is in countries that don't screen till 50, and in the US, if you take that recommendation not to screen till 50, and in countries that are practicing now not self-breast exam, but breast awareness, there's going to be an unmet need in breast cancer screening, because the reality is 50,000 cases of invasive breast cancer occur each year in the US, 1,200 in the UK, and almost 4,500 in Canada every year in women who are under the age of 50. So how are we going to catch these women? And there needs to be more clear guidelines, and these controversies need to be, figured out and hammered out. Annual mammograms are covered by the ACA without cost. So if you want to go for your mammogram from 40 years and get an annual mammogram, you certainly can have that covered. You need to talk to your doctor to decide if you need to do that. And understand that the risk of false positives are high. So if you get a false positive back, when they say, we see something, we need to take you in for a biopsy, you need to understand there's a definite risk that it's a false positive. You should also be screened for your family history and the likelihood that you are carrying a BRCA1 or 2 mutation, because those increase the risk of cancer by 40 to 65%. So if you're carrying one of those mutations, then all bets are off. You're going for screening because you have now an increased risk. If you need that testing done, but you can't pay for it, contact the companies directly and see if you qualify for free testing. They're willing to test a certain percentage of women for free if their financial situation says they cannot be tested. I also strongly advise you to discuss the ideas of self-breast exam and breast awareness with your doctor. They have a whole worksheet that they can go through and teach you exactly what that means. And also for the 3D mammograms, that's something new that's coming out in some of the larger hospital centers. Be aware that if you're not high risk and you're in those ages, in that age group, and you're not high risk, that those mammograms do have a higher radiation dose that they're giving out to take slices and slices and slices of little pictures rather than just, 1 or 2 pictures of that area. So that's it. I hope that you enjoyed this episode of How to Hack Healthcare, and always remember you deserve to be well treated. And if you like these webinars, you can check out some of the other How to Hack Healthcare webinars. And if you need more help, if you need personal help pursuing diagnosis and treatment, we can also do a workbook and a workshop for that. So you can register at that at www.personalhealthinfo.weebly.com, which is my website. And any feedback at all or suggestions for topics is greatly appreciated. I have a number of topics I'm planning to cover, but it's always better to hear from you guys and find out what you're interested in learning about, hearing about, what can help you, anything like that. If you subscribe, all the better, because then you'll get all the latest updates. So thank you very much, and we will see you next time. Bye. Thank you for listening. And for more information, please visit us on the web at personalhealthinfo.weebly.com.